My name is Melissa, and I'm a student at the University of Charleston nursing program. Today, I want to talk about DIC, or Disseminated Intravascular Coagulation. It's a condition that affects the blood's ability to clot and stop bleeding. Abnormal clumps of thickened blood or clots form inside the blood vessels. These clots use up the blood's clotting factors, which can lead to massive bleeding in other areas of the body. Signs and symptoms of DIC with either microvascular thrombosis and frank bleeding include bleeding from the mucous membranes with hemorrhage, bruising, bleeding from venipuncture sites in the gastrointestinal and urinary tracts, which can range from mild to severe. Other symptoms include decreased skin temperature and sensation, increased pain, focal ischemia, petechiae, joint pain, decreased pulses, tachycardia, hypoxia, dyspnea, chest pain with deep inspirations, decreased breath sounds, high-pitched bronchial breath sounds, tachypnea, acute respiratory distress syndrome, heartburn, an abdomen that is firm and tender with distension and increased abdominal girth, decreased urine output, decreased alertness and orientation, decreased response to commands, decreased strength, anxiety, restlessness, decreased loss of consciousness, headache, and visual disturbances. 3 risk factors for DIC include infection, malignancy, sepsis, trauma, cancer, shock, abruptio, placentae, toxins, and allergic reactions. Expected laboratory findings of DIC include progressive decrease in platelet count, decreased urine output, increased creatinine, increased BUN or blood urea nitrogen, increased prothrombin time and activated partial thromboplastin time and thrombin time, decreased fibrinogen, increased fibrin degradation, increased D-dimer, and uoglobulin clot lysis is decreased to less than or equal to 1 hour. Nursing interventions for managing DIC include avoiding procedures or activities that can increase intracranial pressure, like coughing or straining to have a bowel movement or bending over. Monitor vital signs, hemodynamics, abdominal girth, urine output, and neurological status to identify signs of hemorrhage or shock. Avoid use of medications that interfere with platelet functions, such as aspirin, NSAIDs, or beta-lactam antibiotics. Avoid intramuscular injections to decrease the risk of intramuscular bleeding. Monitor external bleeding carefully by timing how long it takes to saturate a dressing, assessing the suction output, and monitoring vaginal bleeding through pad counts. These interventions provide accurate, objective assessment of the extent of the bleeding. Medications that can be used for DIC include cryoprecipitate, that is given to replace fibrogen and factors 5 and 7. Fresh frozen plasma replaces coagulation factors. Platelets to correct severely low levels. IV heparin to inhibit the formation of microthrombi. And if bleeding is profuse and there is evidence of excessive fibrolysis, fibrolytic inhibitors are used with a continuous infusion of IV heparin. The prognosis for DIC depends on the patient's underlying disorders and the extent of the clotting. Regardless of cause, the prognosis is often grim. Between 20 to 50% of patients will die. That number increases to over 80% in patients who develop severe DIC with ischemic thrombosis, frank hemorrhage, or multiple organ dysfunction syndrome. Thank you and have a nice day.